Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. This is our last episode for the Health Conference series. We're exploring food as healthcare with Brad Williams. I know we did the Food as Medicine series. There's probably more we could do on that. But Brad Williams works with Homestyle Direct and is talking about not just delivering meals, but about dignity, health, and love. Making sure good nutrition isn't just a luxury for some folks. You're going to learn about how insurance billable meal programs are changing lives and reducing healthcare costs, and what it means to think about equity in this context. Here's Brad. Hi, Brad. Welcome to the show.
Hey, Raj. Thanks for having me.
Tell me about yourself and your work.
Yeah. So I've been in healthcare for more than 25 years in a range of places and industry in the industry, mostly related around obesity and obesity-related disease. And I find myself today at Homestyle Direct, a medically tailored meal food provider.
That's awesome. And you're at this conference filled with tech. How does it feel?
It's a bit overwhelming at certain times. Lots of folks trying to sell their tech wares, and we're a little bit low tech. We're getting down to the basics of what people need to survive. And we're using food as a catalyst, both to get them what they need, but also, figuring out what meals does somebody need to be healthy? Do they have a chronic disease? Do they have something that is specific that we can do to help them?
Yeah, we definitely can't eat AI yet, so we have to have food, and it's as low tech as you can get. I would love to hear the mission statement for your company, because that really resonated with me on why you're here. I remember I met you and I said, oh, so you do medically tailored meals, and then you're like, no. Tell me, what is your mission and what are you trying to solve?
Yeah, at the basic level, we're trying to eliminate food deserts. We know that people around our country just do not have access to food. I learned a term in the industry. We call it, I think everyone's familiar with food deserts. I know them now as food swamps. There is food accessible to these folks, but it's from the gas station. It's fast food. It's doing grocery shopping at the dollar store. And those foods typically don't align with a healthy course in life. The populations we serve most and our greatest needs have chronic health conditions. Upwards of 70% of the people we serve have type 2 diabetes, cardiovascular disease, renal disease. And that's really what we want to impact is, one, get food on their table so they feel full and have that survival, but also put together a meal program that aligns with their chronic state so they're eating nutrition as well as just meals.
Yeah, incredible. I was looking at your meal plan. This doesn't have microbiome, probiotic, new sodas, all the hype of wellness foods, but your menu was so recognizable. I was like, this is too familiar. Are you sure this is health oriented? Tell me a little bit about your menu and how you go about choosing it and why you went about choosing those items.
Sure. Well, we're lucky we have a wonderful registered dietitian who leads our menu campaign. We hire registered dietitians throughout our organization to help drive our mission because we want to serve not only food and meals, but make sure they're healthy for folks in need. So we try to build a menu that's diverse, and we swap our menu items 3 times a year. So every 4 months or so, we are changing menu items to get rid of food fatigue. It's like going to the same restaurant every night when you're using programs like ours. We want to make sure people have lots of options that are as culturally diverse as we can be, but also make sure that we're providing the right nutrition for people based on their need.
Yeah, I was talking to a few organizations about food because food as medicine is becoming big in healthcare. Yeah. And for the indigenous community, often they're talking about seasonality. Do you incorporate that perspective?
Yeah, we definitely do. Our registered dietitian, our chef, puts together a menu and really tries to get the best products that are in season, but also accessible because we have to bring this in for a price point. So there's a reality to our business and the people and the communities we serve that we've got to do it for a certain price. But we work with a company called JR Simplot, and they're our fruit and vegetable supplier. They are best in class in the country for supplying frozen and vegetables, which lock in freshness at peak ripeness. So when we look at our fruit and veggie programs, we're really talking about fruit and veggies that are picked at the perfect time and then hard frozen. And then we take them and put them into our meals and ship them frozen around the country to make sure people are getting good quality as well as the nutrition aspect.
Also amazing. The other aspect that I heard is about retaining dignity when it comes to food. Food means so many things to people, and at least having some kind of choice. I think you get that with your menu. Do they feel empowered to contact you and be like, hey, I don't have anything that resonates with my culture. What can I do? In my community, we eat this. I wish I had something. When you get that feedback, what does that sound like and what do you do?
I think that's where we actually differentiate with kind of quote unquote low tech on our business, because we have live agents. They're sitting in our office in Idaho, one of our main distribution centers and facilities where we make and deliver the foods. We're vertically integrated, so we take care of not only the food product, but the patients when they call up. We answer the phone within about 45 seconds, 30 seconds is kind of the norm in our business. And then you're talking to a real human. And we touch every member. We give the opportunity for every member on a monthly basis to provide us survey feedback. We take that feedback, and that's how we integrate 4 times a year. We start changing menu items based on the feedback that people are giving us. We look at cultural meals. We look at taste preferences. We try to have a nice variety. I was at a conference months ago, and one of the speakers was very impactful. She said, don't assume that I'm going to eat something just based on the color of my skin and my ethnicity. She said, I like all kinds of food. So we take that into consideration as well. We don't want to pigeonhole people into a certain program. So we really look at their health, their chronic disease that they're trying to improve. And we take all that information, but we then give them choice on the menu. They can pick anything they want to eat off of that menu, and then we box it and deliver it straight to their door. So they feel like they're ordering from a restaurant, which really they are.
Another aspect of the menu that we haven't talked about is don't make the food sound scary different. Meet them where they're at, and then you're making gradual change on nutrition. So it doesn't feel like all of a sudden, I just got to eat kale every day, right? I like kale, but it's not for everybody. That aspect of your work, what does that look like of how you acknowledge where people are at?
I think that's where dignity really comes into play for us. We want to give people the choices and lead them to a healthier choice. People are used to eating fast food and gas station food, and the population we're generally working with are 60 years old and older. We're not going to get them to eat the kale salad and the quinoa right off the bat. We look at our menu and you can get things like enchiladas and a cheeseburger, but we start plating them with fruits and vegetables. We have a drink that has additional vitamins and nutrition included in it to get the calorie intake up, vitamin C levels up. So we look at the person holistically and say, we want to get you on a healthy pattern, but we know we're not going to be able to switch you to the kale salad and the quinoa salad immediately. We've got to give you things that look familiar to you culturally and just what you may be grown up eating or enjoy eating. And we want to make sure that you have that choice, but we want to bridge to perhaps that you can do your own grocery shopping at some point. Maybe you do need to get that fresh produce and learn how to cook. Education becomes part of our mission as well, to eliminate the food deserts, make sure that we're taking care of people who are food insecure, but get them on the road to better health through food.
Digging deeper into the equity question, you told me you were from Idaho. I'm from maybe a metropolitan area. We talk a lot about on my podcast and this podcast about ethnicity, immigrants, refugees. I think there's a part of rural America and there's inequities there. Have you noticed inequities?
I think it's one of our differentiators. Meals on Wheels has been providing these types of services for a generation, and they're still active around city center, the urban markets. The volunteers are there. They're able to reach urban and the suburbs. But when you start talking about the rural areas, it's really hard to deliver a meal to somebody that lives maybe 70 miles away from city center. So our process and our distribution center allows us to touch any zip code across the lower 48. We feel like we can get the same food to somebody that lives in downtown Philadelphia to rural Oklahoma. It really doesn't matter to us where you live. We just want to make sure you're getting the same nutrition. And I think me personally and our organization, we start from a place of love. That's where we want to make sure we're treating everybody with dignity and providing equity across the board. I often tell people, my son is 11 years old. He's autistic. He has special needs that require a lot of support from the community and the resources supplied by a Medicaid-like program. I think about him whenever he's a 65-year-old man. Where is he going to be living? Who's going to be helping him? What kind of food will he be eating? So that really drives me to make sure that we're fulfilling the mission and what we're trying to do to get people good food, good nutrition on a daily basis, regardless of your background, but also thinking about, we want to hear your feedback. Tell us what you'd like to have to eat. And then we can try to incorporate that in our menus.
Yeah, I think commercialization, capitalism can make it so profit-driven that we sacrifice some of the mission. Yeah. Hey, is it worth going to that zip code? It's a little far. It might be easier just to say we can't go there. But your goal is, no, my son could live there one day, and I want to make sure they have that access. I think it's important because we're going into what some would consider a right, which is access to food, a fundamental human right. It's not something that we can determine who deserves or not. Our society is what it is. So we got to figure out how to get it to them. Yeah.
And I agree with that. Our goal is to treat everybody fairly, make sure that they have live agent access when they call and have an issue or a question about the meal programming. Every member that starts with our meal programs, they get an outreach call from somebody, one of our care coordinators, that really describes the program, make sure that they understand what they're getting and why they're getting it, take their meal preferences, take their allergies, and make sure that we're treating that patient as an individual. And every call that they make, it's the first call for them. We treat everybody with that kind of first call mentality, make sure that they're getting what they need in the appropriate time. We're working with tax money through the Medicaid programs that we serve, but we're also working with health plans, Medicare Advantage plans. We got to bring it in for a dollar amount per meal that makes sense for our country because we as taxpayers are paying the bill for all of these programs. We've got to do it with love up front. We feel like if we're going to do the right thing, the money will follow. So certainly we're a for-profit business. We have to pay our employees, and we take joy in paying our employees good wages and bonuses at the end of the year to help our performance. But it really is driven around this mission of love first, treat everybody with that dignity and respect that they deserve, and get them good nutrition. And hopefully they feel that love when they're eating that meal, because that's a lot of what food is for me. And I think a lot of people is the memories of having this meal with your grandmother and, oh, my uncle used to make that dish and he made it that way. So those are a lot of the conversations we have internally to make sure that we're getting the food to the people.
Where can we find you?
Our website, homestyledirect.com. That's the best place to start and get all the information about our company. You can refer members to us that way, and members can get education on our website and figure out if they qualify for programs. Our phone number is listed on the website as well. If you have questions, we'll help you navigate with a live agent.
Thank you. Thanks so much for coming on the podcast.
Appreciate it, Raj.
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized by topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.